We are not safe at all because of the military terrorists. We cannot work anymore at the government hospital. They're killing the country.
Frontline medical workers around the world have been hailed as heroes for their efforts in combating the pandemic, but Myanmar's military have denounced their own doctors as traitors. The Telegraph spoke to one of the doctors working underground. He was forced to flee his own home and he's on the run. We've protected his identity to keep him safe.
Before the coup, I was working at the government hospital for 4 years. On 4th of February 2021, the military junta arrest our elected government and they actually take over the country. We couldn't agree at all this. We need to show our protest in our own way. This is civil disobedience movement. We didn't want anymore at the government hospital. We treat our patient in other way at other place.
Hundreds of doctors are on the run after opposing the military coup and refusing to work in government hospitals at the service of the generals. Under military rule, the country's healthcare system has collapsed. Many medics are operating secret clinics to treat patients at great personal risk.
The military junta arrest, torture, and kill many citizens. Our decision became stronger and stronger. We treat the injured person on the road. We went with the charity ambulance. We went to the place where the strike occurs, and we take care of the injured patient and give emergency treatment. If the injury are so severe, we took to the place where to the operation. Our crew include doctors, nurses, laboratory technicians.
When the military seized power in February this year, medics took the lead in opposing the coup. Thousands walked out and joined a civil disobedience movement. In an apparent act of retaliation, the junta has turned its guns on doctors. The Physicians for Human Rights group has reported that at least 252 healthcare workers and their facilities came under attack during the first 6 months of the military's crackdown. 25 healthcare workers were killed, dozens injured, and nearly 200 were arrested.
I didn't live in my house. I live in another town. They are arresting all the doctors and nurses, especially. They cannot show their mismanagement. They don't want to show that we are treating our patient ourselves. When it became sin for saving lives, it's not a crime. As I said, we just showed our decision, our protest. We take care of our patient like our own way, just not at the government hospital. There's a time limitation for us now to going out. They shoot anyone on the road after 8 p.m. Some days, the patients are calling us. The time is past 8 p.m. We just can't go. There are some patients we lose because of also time limitation.
As street protests died down, a COVID-19 tsunami hit Myanmar, leaving hard-pressed medics to try to treat a surge of patients without adequate facilities or vital supplies of oxygen. Imagine if at the height of the UK's own COVID outbreak that it wasn't possible to call an ambulance after 8 p.m. or that public hospitals didn't exist. That's the situation facing much of Myanmar just now.
Our country is under the military junta, under the military terrorists, nearly 60 years. I don't want our generation or our future kids suffer. I don't want them to suffer like our parents, like our grandparents. They are killing the country. They made our country poorer and poorer. We have no hope with the leader of this military terrorists. We need federal democracy.